we love what we do, and that's what we're here to do, is to share that in this podcast format.
Yeah, I think when you're open and honest with patients during the consult or otherwise, I think that they're that much happier during the recovery process because they know what they're getting into, they know what to expect, and they're not blindsided by what's really happened to them.
Yeah,
So,
and it's really all about setting expectations. It's all about counseling. It's all about, in my practice, I call my practice a boutique practice. I don't care to be this mega factory of plastic surgery. I take full ownership of every patient that comes in here, and I'm with them from the initial moment of the consultation throughout the whole process. And I explain things to them. I go over the consent forms myself. Dr. Ladner, you might have some different styles than I do, but for me, at the end of the day, I think we want the same thing, and that's for people to be informed, people to have realistic expectations that we are setting with them.
Yeah.
You can't come in here and expect Photoshop to happen after surgery. Because we're dealing with the human body, living tissue, and when you change one thing, it is also going to change other things around it.
Yeah.
And so all of these things need to be explained to folks, and to make sure that they're making the best decision for them. And sometimes that's just not to even proceed with surgery.
Yep.
That's why I think both of us have non-surgical solutions and surgical solutions.
Or sometimes no solution.
Or no solution. Maybe sometimes it's just a conversation that we have with them.
Yeah.
So let me ask you, our practices are very similar, but maybe you can just mention a little bit about the highlights of your practice and the services that you provide, and I'll kind of piggyback off of that.
Perfect, yeah. So I've been doing this in my own practice for the last 12, 13 years. This is my 13th year in practice. As Dr. Ardesh stated, I started my first practice in Denver, Colorado. I think that in Denver, it's a very natural appearing crowd. People really, I think, want to achieve a very natural look, but a refreshed look. I also think because it is sort of a tech-heavy, young professional area, people are looking to maintain a competitive advantage and edge when they come to work, and I think that's a big driving factor. I think in Los Angeles you still have some of that, but it may be a little bit of a different crowd for sure. My specialty is in facial rejuvenation and closed rhinoplasties, so we'll get into this in future podcasts, I'm sure. But I have really kind of evolved into being more of an open rhinoplasty surgeon at the beginning of my career to doing more and more closed rhinoplasties. That's about 50% of my practice, and then the other 50% is the facial rejuvenation procedures, facelifts, brow lifts, upper and lower blephs, chin augmentations, neck lifts, et cetera, et cetera. So I think very similar to your practice. At my office in Colorado, I don't do any of the injectables myself, but I do have 3 injectors that do that. And I think that's an integral part of any successful facial plastic surgery practice. Because I've wanted to focus on doing more surgery, I do have other people that help me out with that. So now you, on the other hand, tell me a little bit about how yours differs.
So there is a difference, I think, between LA and Colorado in the average look that people are going for. Nonetheless, my style is a natural look. I think I was in academics, and by academics means that I was a university professor for the first 4.5 years of my practice. And then I opened up the practice out here in Beverly Hills it was 6 years ago. And so, which was one of the best decisions of my life. Just to basically take full ownership of my own practice and the choices that I want to make with my patients, as opposed to have a big entity like a university kind of dictating what I could do and what I can't do. So for me, my practice, very similar to yours, focuses on facial rejuvenation, facelifts, neck lifts, eyelid surgery. About half of my practice is also rhinoplasty. Probably that's split between closed and open rhinoplasty, and we'll get into this more in the future. I also do a lot of hair transplant surgery. That's FUE, which is the minimally invasive hair transplant surgery. And then I do my own injectables. I do my own Botox, Dysport, Restylane, Juvederm, because I enjoy it. It actually complements my practice, and I think, and a small part of my practice is still actually doing some reconstructive surgery, like skin cancer reconstruction. And for me, I enjoy doing those surgeries because they're kind of puzzles. I'm putting people's faces back together.
Yeah.
And I do think being a great reconstructive surgeon makes you a great cosmetic surgeon, and a great cosmetic surgeon is also going to help your reconstruction. So all these things help each other.
Yeah.
I'm going to go down the road and I want to share with people how I even ended up in Beverly Hills.
Yep.
And it actually has a lot to do with Dr. Ladner. So Dr. Ladner's brother used to live in West Hollywood.
Yep.
And I got invited to go to a party. I didn't know anyone in LA, so I got invited to go to a party at their home.
Yep.
And it was a great time. I ended up passing out on the couch, and like we used to back in the day. And so the next
What
morning,
better place to do it?
yes, exactly. So next morning I wake up and it was super early, and I end up just driving to the beach.
Yeah.
And I explored Santa Monica for the first time, and I just fell in love with it. So
Yeah.
I found a place for rent. I put down the deposit, and I just realized I wasn't happy with my other position at the university, so I left.
Yeah.
Traveled for a few months, and then I opened up my practice. One of my favorite stories is I did a facelift and a neck lift on a patient who was around in her early 50s.
Mm-hmm.
And just about 2 years earlier, she had gotten divorced from her husband.
Mm-hmm.
Well, 2 years after the face and neck lift, her and her husband actually got back together. And they're still together today. And that was, I don't know, maybe about 6 years ago.
Yeah.
So like these are stories that are really rewarding.
That's not common, by the way. Let's put that out there.
There's the disclaimer. We're not promising that you're getting your relationships back together because of these procedures. But I think for the most part, it's about allowing people to feel their best, to love themselves, and to just enjoy life to their fullest. And that's what we're chasing here.
Yeah, absolutely. And I think, one of the things that we've alluded to, but we haven't discussed here, is really this is kind of a game of maintenance, right? You mentioned weight loss. And so with weight loss, you don't just go to the gym for a week and then you expect that that's going to increase your metabolism for the rest of your life. And so even with facelifts, which sounds like a drastic procedure, a lot of these sort of lesser invasive or not as involved facelift versions that we're doing, I actually kind of view that as maintenance, right? So in other words, whether you're 45 or 50, that may get you another 5-7 years, but it's not going to be your last procedure. And I never try to trick people into thinking that this is going to be a one and done for a procedure like that. So if you're doing Botox as an example, you're trying to maintain that skin appearance, avoiding wrinkles, okay, that's not really treatment, that's maintenance. And that's no different than taking care of your body when it comes to eating, going to the gym, flossing your teeth. I really kind of view what we do in that same globe, that same sphere, in terms of knowing that there's going to be a commitment to maintaining the best version of yourself really for a lifetime.
Yeah. No, I think it's... for Botox, like one of the things I like to tell my patients that Botox does not replace surgery, and surgery does not replace Botox. So if you come to us for surgery, even if it is a brow lift, you're still going to need a, if you're going to come to us for surgery, like a brow lift, you're still going to need your Botox. Because a brow lift does not get rid of the lines that go across the forehead. Botox is the way we control that. Now, maybe back in the day, there was very aggressive brow lifts happening where surgeons would actually pull out muscles and destroy nerves, and then you can't move your forehead at all. But again, that looks surgical, that looks weird. That's why there's a lot of people still walking around that look strange.
That's right.
Same thing with the neck. Face or neck lift is not going to get rid of all the lines that run across your neck, but it is going to create that tight neck. So those lines are still there, and you might still need some Botox there to soften those lines a little bit. So for me, the line that I grew up in high school, I was taught that practice does not make perfect, practice makes permanent. Mm-hmm. So all of these habits that we form, and we want to form good habits, and it's hard. We kind of lose our way. Sometimes we just, life gets in the way, and you kind of lose track of, the path that you were on or what you were taught. But you really want to develop good habits because those are things that are being set in stone for life. So for Botox, now this sounds very superficial, I understand that, but for Botox, when you maintain your Botox every, let's say, 3 to 4 months, let's say 4 months, you come in and you get your Botox, that is preventing those deep creases along your face and along your necklines. And so for me, that's going to help you look your best. For a guy, for guys losing their hair. It might start early in your 20s, it might start in your 30s. Well, with a little bit of medication, we can actually get your hair back, and then we can maintain your hair. Now, you might still need a hair transplant. I mean, I might still recommend that we perform a hair transplant for you to add more hair, but we need you to maintain and hold on to what you have. And that might be as easy as taking a little medication or applying a little topical medication.
Yeah.
So
it's not a one-size-fits-all approach. It's a customized approach. We don't hit every nail with the same hammer, right?
Absolutely.
And that's the purpose. I think that you perform your consults very similar to how I perform them. We're spending 45 minutes to an hour with patients going through all of their treatment options, talking about the risks, the benefits of each one of those options, and really what they're getting themselves into, right? Even with these lesser invasive, minimally invasive procedures that we're doing, it still requires downtime. It still requires the fact that a lot of our patients are busy professionals and need to take a week or two off of work. And that's where really kind of educating them in a very honest way, I think helps, like I was saying earlier, helps on the back end in terms of recovery and really planning for that procedure.
Yeah. And so just something that entered my head as you were saying that is, it's funny, everyone always thinks, wow, having a surgical procedure, that is going to take a lot of time, a lot of recovery, possibly also it's going to be really expensive. But a lot of these non-surgical procedures that are performed all throughout the country in many spas, by non-surgical professionals, by surgical professionals, some people that have actually been trained in aesthetic surgery, some people that really have no idea anything, they don't have any clue about cosmetic surgery, but they just want to enter the field and open a business.
Yeah.
The recovery for a lot of these things are about the same.
Yeah, absolutely. So this is a great thing. So I love to use this example with patients. I've been using Botox myself. Dysport really is what I use now, but been using neurotoxins in my own face for the last 13, 14 years, something like that, and I'm a happier man for it. I always inject myself just because I know my facial anatomy obviously better than anyone else, having done it now for the last 13 years. So every 3 to 4 months I find myself, usually in my bathroom or my kitchen with a Botox needle and shoot myself up. One time it went wrong, and I was doing my crow's feet, so the orbicularis muscle. And I'm a pretty vascular person, so I ended up hitting a vein. I thought I knew my anatomy, I guess, better than I did. And I ended up having a bruise in my eye, around my eye, for 2 weeks.
Yeah.
Now the ironic part is that I tell my facelift patients that you should expect 2 weeks of bruising, or at least 2 weeks until you're able to conceal it. And here I was, I'm not a makeup wearer, I don't know about you, but I tend not to wear makeup.
Mostly mascara, but
guy liner from time to time. But so here I was, I had 2 weeks of bruising. I still showed up to work the next day. I didn't care, I owned it. I told everyone exactly what I did.
Yeah.
Because guess what, we're in this industry, and a lot of people, whether it's bleaching their teeth, getting Botox, going to the hairstylist for extensions, getting eyelash extensions, people are into beauty and being the best versions of themselves.
Yeah.
And so a lot of my patients, honestly, that's why I tell them up front, expect this amount of time in terms of recovery. And a lot of them really are okay with it, despite being young professionals, because they say, guess what? I don't care if anyone knows that I had this procedure. Yeah. In fact, they're owning it.
Yeah, there's really not much, there's still a stigma around all this stuff, but for the most part, this stuff has become pretty ubiquitous.
I think that's gone away.
Ubiquitous, especially in places like my 2 offices, being Rodeo Drive in Beverly Hills and in Newport Beach.
Yeah.
In Southern California, pretty much most people just accept the fact that everyone's getting their Botox done, so there's really no stigma to it. The other thing that comes into play here, though, is cost.
Yeah.
When you actually look, now I do perform some thread lifts in my practice, and we'll go over this in another episode or so.
And I don't do those. That's it's one place where we might differ.
Yeah, so it's not a large part of my practice, but I do think it adds some, it's a complement in some patients. But for me, I hear patients going to, medi-spas and places where they get threads, and they will easily spend $7,000 on threads.
Right.
I mean, I don't understand. Or they might have some sort of non-surgical radio frequency procedure where they might be paying $10,000.
Right. And then they wish they had it back in their pocket after the said procedure to save up for their facelift.
Yeah, well, so that's what happens. Or then, they've been promised, just the expectations was, oh, I'm going to go in and get filler. and filler is gonna lift up my face. That's what they've been led to believe by marketing, by their physicians, by nurses or friends, family. I guess one thing I want to segue to is, Dr. Ladner, you've been coming out here now for just a couple months.
Yep.
What is it that coming to Rodeo Drive in Beverly Hills from Denver, Colorado, what kind of things are you planning on doing that are going to make you stand out from the other practices? Because I can say on this block alone, there's probably 50 plastic surgeons. So, and then look at LA, all of LA, and then Orange County. What is it that you're bringing that you're hoping that people find out about you that makes you stand out?
Yeah, I would say other than my my sense for fashion.
I'm loving the socks. By
Thank
the way.
you. Yeah.
I'm going to have to borrow some socks in the future.
And also some occasional sardonic comments and attitude that I bring. I think that the way that I'll stand out, and I would say the way that maybe we will stand out, is that here together and cohabitat, co-spacing, roommating, whatever you want to call it here, as colleagues, we're actually able to really bring each other in for second consultations, help out each other with procedures. If we have a difficult patient, then there's not just one of us. And so we're able to really kind of collaborate and use, hopefully, what I would say is two intelligent minds rather than one.
Yeah.
And I think that stands out from a lot of practices here where there's only one plastic surgeon in the office.
Yeah. So, I mean, our plans here is we have two separate practices. You're your practice, I'm my practice.
Right.
But if I feel for some reason that someone might be a better fit for you, I would make the referral to you and vice versa. And then sometimes we do what we call co-surgery, where you might be assisting me, I might be assisting you, and more or less we're trying to just to put our minds and our hands together to get the best results for the patient.
Yeah. And then I would add two things to that too, which is number one, where I'm at in my career. I can't imagine making this podcast when I started my practice because quite honestly, I had the surgical training, but I didn't have the life and career experience that I can now bring to the plate, right? And that goes for the way that I work with staff, the type of staff that I employ, how to screen for the correct patients for the appropriate procedure we're going to offer them, mistakes that I've learned from along the way. And not just surgical mistakes or things that I would have done differently, but maybe was it a decision-making issue? So I think bringing that to the table is super important. I also think that the stylistic approach that you were mentioning earlier, being in Beverly Hills but offering maybe more of a natural approach, I think that I can also take what I've learned from being in Colorado. Now, granted, we have patients that travel from coast to coast, sometimes even international, but taking that approach and maybe embedding it in a Beverly Hills approach, which has been stuck in its ways for years, I think also could be advantageous to patients here. I would add, I think this is one of the biggest advantages of having technology, having exposure to the internet, going online, and seeing our photo galleries. If you think about plastic surgery 20 years ago, patients were hearing about plastic surgeons either by word of mouth or by literally opening up the yellow page book, going to the phone book and saying, okay, who's close to me? Now patients have the ability to go to each one of our individual photo galleries, make sure that we're doing a lot of these procedures, make sure that they can identify with a specific type of result in patient that they see that maybe looks like them, make sure that the way that we're doing the procedure is in line with what they're expecting. And if we're not the right fit, then by all means, we want that patient to go elsewhere to get treatment.
Yeah.
Because at the end of the day, neither one of us, both patient and physician, are going to be happy.
Yeah. And